Hi, my name is Jenny Mosquera, and with this video I would like to show how to do a head-to-toe assessment. First, I would like to start explaining the general overview. We have to gather all the equipment necessary for make the exam. So we have here the blood pressure cuff, thermometer, otoscope, pen light, and a stethoscope. Also, we have here hand sanitizer to perform a hand hygiene. To make the exam, we have in general to make inspection, palpation, percussion, and auscultation, except in abdomen that we first have to have the inspection, then the auscultation, then we have to percute, and finally we have to palpate the abdomen. Before everything, we have to make a rapport with the patient. We have to introduce ourselves. We have to explain what we are going to do. We have to address any question the patient have. From the moment we enter the room, you can start making mental notes about your patient. For an example, the general appearance, the posture, the skin color, sign of distress like if the patient is confused, pale, sleepy, if patient has anxiety, if patient has depression, if patient has a good contact eye with you, and in general also the hygiene of the patient and the dress code. Also, we have to assess how is the patient's ambulation, if it's a normal ambulation or if a patient has, like for example, shuffle gait, or if the patient has trouble in balance, or if the patient has pain with ambulation. Now we are going to proceed with the exam. First of all, we are going to take the temperature, 98.0. This is the temporal temperature, could be oral, could be axillary, could be rectal temperature, but now we choose to have a temporal temperature. Now we are going to proceed to take the blood pressure to a patient. Please, can you give me your hand? Can you extend your hand, please? Thank you so much. It's great. Your blood temperature is 120/8. This is a normal blood pressure. Now we are going to proceed to take the heart rate. Can you give me your hand, please? Heart rate should be given in 1 minute if the patient has arrhythmia. If not, we can perform it in 30 seconds. Okay, your heart rate is 80 in between the normal limits. Now we are going to proceed to take the respiratory rate. We can do it by inspecting the chest, or gently we can palpate the abdomen to see the movement of the abdomen as a respiration rate. This is also be doing in 1 minute. Okay, your respiration rate is 16, so it's normal. Okay. It's important to tell you that we have to make we have to gather the weight of the patient and the height, and then to put in the table to see the BMI as a to have an idea how is the nutritional status. Now we are going to proceed to examine hair, nail, and skin. In hair, we have to assess. Can you please untie your yeah, thank you. We have to proceed to see the hair distribution depending on the age and the gender. We have to see if there is fragile, if not, if there is any infestation. At the same time, we can palpate the scalp, looking for a scar, bone, depression. It's important to tell you that in children, infant, we have to make the head circumference to palpate fontanelles anterior and posterior and to see if there is any bulge or depression. Assessing the skin, we have to be sure to take the temperature, moisture, the skin texture. We have to palpate the skin to see if there is edema, if there is wrinkles, if there is any bruise, any scar. To assess the nail, we have to see how the nails are, the consistency, if there is a clubbing nail, if we have, it's very important to assess the capillary refill. We have to press the nail, there is a blanchable color, and when we release the nail, it should be pink again in around 2 or 3 seconds. If it's appear more than 3 seconds, we can say that the patient has a vascular or cardiovascular disease. Now we are going to assess the head. In the head, we can see the shape, if it's rounded, if it's symmetric. Can you smile, please, for me? Can you open your mouth? Thank you. Can you close your mouth? Can you try to? We are going to assess the masseterial muscle. We are going to assess if there is a symmetric in the eyes, in the face. So we're going to assess also the inside of the mouth with a depressor. Can you open your mouth? Can you take your mouth off? Thank you. If there is any cavities. Now we are going to examine the eyes. So the external structures, we are going to see eye symmetry. We are going to check conjunctiva and sclera to see if there is any abnormal color like jaundice, redness, or if it's normal. We have also to check for perla. It's very important in the eyes to check for perla. That it means pupil equal, rounded, reactive to light and accommodation. For that, we have to assess with the pen light, and we are going to put the source of light to see if the pupil can constrict with in a normal response to the light. When we put the lights on the pupil tries to constrict or to make a meiosis. We have also to perform a visual acuity with the Snellen chart. We have also to check for eye drainage. We have to check for the 6 cardinal position of the gaze. So, can you please Without moving your head, can you follow my hands? So we assess now the six cardinal movement of gaze. Now we are going to palpate the nose to see if there is any asymmetry, if there is any deviation. We can see the nares. We can inspect also the mucus inside, if it's dry, if it has mucus, if there is any bleeding. We also can assess the sense of smell by putting some product that smell. Take the patient to close your eyes, please. Close your eyes. Can you sneeze this? Okay. So patient should tell me what does he smell. Now we can inspect the ears. The ears should be inspected also by inspection. We can palpate to see if the patient has any pain. Do you have any pain? Do you have pain in here? And here? No. So we are going to assess the inside of the ear with the stethoscope to see the tympanic membrane. Thank you. Now we are going to assess the neck. We can see we have to check the neck muscle. We can palpate lymph nodes. Now we are going to check the head movements. Can you please move your head to your right? No, your head. You can move your head to your right. Thank you. Now to your left. Can you put your head up? Now your head down. Down. Perfect. Do you have any pain when you did this? Any pain? No pain? Okay. Now we can assess the shoulder movement. Now we can inspect or make an assessment for the cranial parts 11. Can you shrug your... Okay, thank you. Also in the neck, we can assess the trachea, if it's central, if there is no deviation. Can you swallow, please? Tragar. Okay, there is no mass, that is mobilization with the swallowing, because sometimes when the patient has some thyroid trouble, nodule or mass, the mass can move with the swallowing function. I'm going to proceed to palpate the thyroid. Patient has to be seen to the front with a slight flexion, mini flexion, and we can palpate to see if there is any nodule. Can you swallow, please? Tragar. Now we are going to perform the chest examination. In the chest, we can find the cardiovascular assessment. So we're going to listen to the heartbeats. It's important to know the 4 cardinal points for auscultation, that it should be aortic, pulmonary, air point, tricuspid, and mitral. Also, it's very important in the chest to auscultate for any bruise in the carotids. So we are going to place the stethoscope to see if there is any bruise in the carotid. To assess the respiratory system, we have to auscultate long sound, front and back. But before, as I'll tell you before, is inspection, palpation to see if there is any fremitus. Can you stand up, please? Can you turn around? Can you say 99? The 99.
99.
Again?
99.
Thank you. The auscultation should be from side to side. Thank you. Can you stand up, please, and turn? From side to side. Now we're going to assess the abdomen. First of all, we have to make the inspection of the abdomen. The patient should be done from here onto the inguinal areas. After inspection, we have to auscultate the abdomen in the fourth quadrant. Then the percussion should be done also. And then we have to make a palpation of the abdomen. The palpation should be first doing superficial, and then we have to do the deep palpation. We have to assess if we palpate the spleen. Here, if we can palpate the liver and all the abdomen, if there is any masses, tumor, or something. Now we're going to assess the extremity of the patient. If they are symmetric, if there is any abduction, when it happened in a fracture of the hip. If there is any strength, can you please put this like this? Can you try to lower the neck? Thank you. The other one. Thank you. Can you flex your feet? Can you try to dorsiflex your feet? Thank you. Now we can do the palpation of the pulse. We have the femoral pulse here and here. We have the popliteal pulse, should be assessed here. We have the pedial pulse. medial pulse, and we also can assess the posterior tibial pulse. Now we can assess the back area, the back side of the body. We have to inspect the back and the spine. We have to see if there is a rectal linear in the spine or there is any deviation like scoliosis, kyphosis, lordosis, if there is any hip elevation more than the other. And we can also make the patient to tell to bend down or out to the right or to the left to see if there is any pain or any incapacity to do this. So with this quick video, I would like to show the professor how do I assess the physical exam. It's very important, the physical exam, because we can gather most of the information of the patient. The head-to-toe assessment should be in an order, should be detailed. We have to explain the patient all we are going to do because patient feel more relaxed. There is a lot of information that we can find through the head-to-toe assessment.